Pancreatic cancer is one of the most dangerous and aggressive forms of cancer, with a frighteningly low survival rate of just 10% after 5 years. According to the American Cancer Society, over 64,000 people are diagnosed with this silent killer each year in the United States alone. What makes this type of cancer so deadly is how often its warning signs are either ignored or mistaken for less serious issues, allowing it to go undetected until it's too late for effective treatment. Sadly, many people don't realize the danger until the disease has progressed to a late stage. But today, we're here to help change that. In this video, we're going to explore 11 shocking warning signs of pancreatic cancer that you should never ignore. These signs might seem subtle, but knowing them could make the difference between life and death. Before we dive in, welcome to the channel. We're committed to providing you with essential health information that could save your life or the life of someone you care about. And make sure to stick around, because sign number 7 is one of the most dangerous and often overlooked. It's vital that you hear it. Let's get started. Why awareness is key. Before we get into the signs, it's crucial to understand why awareness of pancreatic cancer symptoms is so important. This type of cancer is often called the silent killer because it tends to grow undetected until it has reached an advanced stage. The pancreas, located deep within the abdomen, doesn't always show obvious symptoms until the cancer has spread, making early diagnosis extremely difficult. This is why so many cases are discovered when the options for treatment are limited. Now, you might be wondering why it's important to stick around until the end. Often, a single symptom may not be enough to raise alarms. But when you start noticing several of the signs we'll talk about today occurring together, it's time to take action. That's why it's essential to recognize all of the symptoms, as this awareness could truly make the difference between early detection and a late-stage diagnosis. So why should you be concerned? Because many of the early symptoms can seem like everyday health issues, such as digestive discomfort or fatigue. These are easy to ignore or chalk up to stress or poor diet. That's why being informed about what to look out for is so essential. If you know the subtle signs, you can take action sooner, and early detection is the key to improving survival rates. Understanding pancreatic cancer. Let's take a moment to understand what pancreatic cancer is and why it's considered one of the most dangerous cancers. The pancreas is a critical organ located behind the stomach, responsible for producing enzymes that aid digestion and hormones like insulin that regulate blood sugar levels. When cancer develops in the pancreas, it can interfere with these vital functions, often causing symptoms that seem unrelated to the pancreas itself. This is where the danger lies. Pancreatic cancer symptoms are usually subtle and easily mistaken for common health problems, such as minor digestive issues or general fatigue. These vague symptoms allow the cancer to progress unnoticed, and by the time it's diagnosed, it's often in an advanced stage. This delayed detection is a big reason why pancreatic cancer has such a low survival rate. Understanding how pancreatic cancer affects the body and recognizing its early signs can make all the difference. By staying informed, you increase the chances of catching it before it's too late. Stick with us, and by the end of this video, you'll know what to watch out for to protect your health or the health of someone you care about. 11 shocking warning signs of pancreatic cancer. 1. Unexplained weight loss. One of the most common early signs of pancreatic cancer is sudden, unexplained weight loss. While many might see this as a benefit, losing weight without changing your diet or exercise routine can be a major red flag. In fact, a study published by the Journal of Clinical Oncology found that unexplained weight loss is present in up to 80% of pancreatic cancer cases. This happens because the cancer can disrupt the pancreas' ability to produce enzymes that help digest food properly, leading to poor absorption of nutrients. One notable patient case involved a man in his late 50s who experienced a steady, unintentional drop in weight over several months. At first, he attributed it to stress and changes in his eating habits. But when his weight loss reached 15 pounds without any effort, he sought medical advice. After a series of tests, pancreatic cancer was diagnosed in its early stages, allowing for more treatment options. What's concerning is that this type of weight loss can be gradual, making it easy to dismiss or overlook. Both fat and muscle mass can be lost, even if you're eating as usual. If you or someone you know experiences a significant drop in weight without an obvious cause, it's crucial to seek medical advice. This could be one of your body's earliest signals that something is wrong, and catching it early could make all the difference. 2. Jaundice, yellowing of the skin and eyes. If you notice your skin or the whites of your eyes turning yellow, this could be a sign of jaundice, which is often linked to pancreatic cancer. Jaundice occurs when bilirubin, a yellow pigment produced by the liver, builds up in the body. This can happen when a pancreatic tumor blocks the bile duct, preventing bile from draining into the intestines. The result? Bilirubin accumulates in the bloodstream, causing yellowing of the skin and eyes. Research from the Lancet Oncology indicates that jaundice is one of the most common early symptoms of pancreatic cancer, especially when the tumor is located in the head of the pancreas. In fact, up to 70% of patients with tumors in this region experience jaundice as an initial sign. Besides the yellowing of skin and eyes, jaundice can also cause dark urine, pale stools, and even persistent itching. These symptoms, though subtle, are critical warning signs that something may be wrong. If you or someone you know is experiencing these changes, it's important to seek medical advice immediately. Early detection of pancreatic cancer can significantly improve the chances of successful treatment. 3. Abdominal pain that radiates to the back. Persistent abdominal pain that radiates to the back is a common symptom of pancreatic cancer, particularly when the tumor is located in the body or tail of the pancreas. This type of pain is often dull and persistent, gradually worsening over time. Many patients describe it as starting in the upper abdomen and radiating toward the back, sometimes becoming more intense when lying down or after eating. According to a study published in the British Journal of Cancer, about 70% of patients with advanced pancreatic cancer report this kind of pain. Unfortunately, this symptom is often mistaken for less serious conditions, such as indigestion, gallbladder issues, or even back strain, leading to delayed diagnosis. One case study published by the Journal of the National Cancer Institute discussed a patient who had experienced this abdominal pain for months, believing it to be due to common gastrointestinal issues. By the time the correct diagnosis was made, the cancer had already progressed. If you experience persistent abdominal discomfort, especially pain that spreads to your back and worsens over time, it's crucial to seek medical attention. While it may seem like a minor issue at first, this type of pain can be an early sign of pancreatic cancer, and early detection can be life-saving. 4. Digestive problems. Sudden digestive problems, such as difficulty digesting food or persistent bloating after meals, can be a significant sign that something may be wrong with your pancreas. The pancreas plays a critical role in producing enzymes that help break down food in the digestive process. When a tumor forms in the pancreas, it can block the production or release of these enzymes, leading to what's known as exocrine pancreatic insufficiency. This condition results in poor digestion, causing food to pass through the system without being fully broken down, leading to malabsorption of nutrients. Common symptoms include frequent bloating, gas, diarrhea, or greasy stools, known as steatorrhea, as well as feeling full very quickly. Research published in the Journal of Gastroenterology and Hepatology highlights that digestive issues are often one of the first signs noticed by patients with pancreatic cancer, but are frequently misinterpreted as common gastrointestinal problems like irritable bowel syndrome, IBS. One case study detailed a patient who experienced bloating and frequent indigestion for months, thinking it was related to diet. It wasn't until weight loss and other symptoms developed that pancreatic cancer was diagnosed. If you notice persistent digestive problems that don't respond to typical treatments, it's important to consult your doctor for further investigation. Early detection can make all the difference. 5. Loss of appetite. A sudden and unexplained loss of appetite is another potential warning sign of pancreatic cancer. While a reduced appetite can happen for a variety of reasons, stress, infections, or dietary changes, when it persists and occurs alongside other symptoms like weight loss, abdominal pain, or digestive issues, it could indicate something more serious. In pancreatic cancer, tumors can press against nearby organs, including the stomach, making patients feel full after eating only a small amount. Studies published in the World Journal of Gastrointestinal Oncology indicate that loss of appetite, known as anorexia, is a common symptom in patients with pancreatic cancer, often contributing to significant and unintentional weight loss. The tumor can also alter the digestive processes by affecting enzyme production, which leads to poor nutrient absorption and further diminishes the desire to eat. If you or someone you know is experiencing a persistent lack of hunger, especially when combined with other signs like unexplained weight loss or fatigue, it's crucial to consult a healthcare professional. Early diagnosis and treatment can have a profound impact on managing this disease. 6. New onset diabetes. Suddenly developing diabetes or finding it difficult to control your blood sugar levels, especially if you've never had issues before, could be an early warning sign of pancreatic cancer. The pancreas is responsible for producing insulin, the hormone that regulates blood sugar. When a tumor forms in the pancreas, it can disrupt this critical function, leading to the onset of diabetes, even in individuals without previous risk factors. Studies published in the Journal of Clinical Oncology have shown that approximately 40% of patients diagnosed with pancreatic cancer also experience new onset diabetes within months of their diagnosis. This relationship is particularly concerning when diabetes appears suddenly in individuals over the age of 50 with no family history or other traditional risk factors for diabetes. Additionally, if you already have diabetes and suddenly find it much harder to control your blood sugar levels, it could be a signal that your pancreas isn't functioning properly due to the presence of a tumor. This is why it's important to monitor any changes in your health, even seemingly unrelated ones like blood sugar levels, and to seek medical advice if you notice anything unusual. Early detection can significantly improve treatment outcomes for pancreatic cancer. 7. Dark urine or light-colored stools. Changes in the color of your urine or stools can be subtle but significant warning signs of pancreatic cancer. Dark urine and pale or light-colored stools are often linked to a blockage in the bile duct, which can occur when a tumor in the pancreas presses against or obstructs this duct. Normally, bile produced by the liver helps digest fats and gives stools their brown color. When bile flow is blocked, it results in lighter stools and dark urine due to the buildup of bilirubin, a yellow pigment. A study in the Journal of the National Cancer Institute notes that such bile duct obstructions are common in pancreatic cancer, particularly when the tumor is located in the head of the pancreas, where it is most likely to interfere with bile flow. These symptoms often appear before other, more recognizable signs of pancreatic cancer, making them an important early indicator. Additionally, patients may experience itchy skin or jaundice, yellowing of the skin and eyes, due to the same bile duct blockage. If you notice any persistent changes in urine or stool color, along with other symptoms, it's crucial to seek medical attention. Catching these early signs can lead to quicker diagnosis and more effective treatment. 8. Itchy skin. Itchy skin might seem like a minor everyday nuisance, but when it occurs along with other symptoms, it could be an important indicator of something more serious, such as pancreatic cancer. This type of itching is often related to a buildup of bile salts in the bloodstream, which happens when a tumor blocks the bile duct. When bile can't flow properly from the liver to the intestines, it accumulates in the blood, causing not only jaundice, yellowing of the skin and eyes, but also intense itching. Research published in the American Journal of Gastroenterology highlights that persistent, unexplained itching, especially when accompanied by jaundice, dark urine, or light-colored stools, can be an early sign of pancreatic cancer. The itching is typically more severe and widespread than common skin irritation, and it may not be relieved by typical remedies like lotions or antihistamines. If you're experiencing itching alongside other symptoms like fatigue, loss of appetite, or digestive issues, it's essential to take it seriously and consult a doctor. While itchy skin alone might not seem concerning, when it's linked to bile flow obstruction, it could be one of the earliest signs that something is wrong with the pancreas. 9. Fatigue. Chronic fatigue, the kind that doesn't go away even after rest, is a symptom that often goes unnoticed but can be a sign of something serious, including pancreatic cancer. Fatigue related to cancer is different from normal tiredness. It's more persistent, often overwhelming, and isn't relieved by sleep or rest. In pancreatic cancer, fatigue can be caused by a combination of factors, including the body's response to the tumor, the loss of appetite leading to malnutrition, and the body's increased energy demands in fighting the disease. A study published in the Journal of Pain and Symptom Management found that 90% of pancreatic cancer patients report fatigue as a major symptom, often occurring in the early stages of the disease. Many patients in these cases initially dismiss their fatigue as a result of aging, stress, or other common factors. However, one patient case revealed that persistent fatigue, combined with weight loss and digestive issues, ultimately led to a diagnosis of pancreatic cancer after months of unnoticed symptoms. If you're experiencing unexplained long-term fatigue that doesn't improve, especially when coupled with other signs like weight loss or digestive problems, it's essential to consult a healthcare professional. Fatigue could be your body's early warning that something is seriously wrong. 10. Blood clots. Blood clots, also known as deep vein thrombosis, DVT, can be an unexpected and serious symptom of pancreatic cancer. While most people associate blood clots with conditions like immobility or surgery, cancer, including pancreatic cancer, significantly increases the risk of clotting. This is because cancer cells can activate the body's clotting system in abnormal ways. If you've experienced unexplained blood clots, especially without common risk factors such as prolonged sitting, recent surgery, or family history, it's crucial to mention it to your doctor. Research from the American Society of Hematology found that cancer-related blood clots are common, with pancreatic cancer being one of the leading types linked to increased clotting risk. Studies showed that up to 30% of patients with pancreatic cancer experience blood clots at some point, often before the cancer is diagnosed. In one notable case, a patient experienced repeated episodes of DVT and pulmonary embolism, a clot in the lungs, leading doctors to investigate further. Eventually, pancreatic cancer was discovered as the underlying cause. If you're dealing with blood clots without a clear cause, it's important to seek medical advice immediately. Early detection of pancreatic cancer can make all the difference, and blood clots might be an early warning that should not be ignored. 11. Nausea or vomiting. Lastly, if you're experiencing frequent nausea or vomiting, particularly after meals, this could be a sign that your digestive system is being impacted by pancreatic cancer. As tumors grow, they can obstruct parts of the digestive tract or prevent the pancreas from releasing the enzymes necessary to properly break down food. This can result in food sitting in the stomach longer than normal, causing discomfort, nausea, and in some cases, vomiting. It may seem like a minor issue at first, but when it persists, it's important to take notice. A study published in the Journal of Gastrointestinal Cancer found that gastrointestinal symptoms like nausea and vomiting are prevalent in pancreatic cancer patients, especially when the cancer is located near the bile ducts or stomach. One case described a patient who dealt with nausea for weeks, initially thinking it was due to a stomach bug. However, the ongoing symptoms led to further investigation, which eventually uncovered pancreatic cancer. If these symptoms are frequent and occur with other signs like unexplained weight loss or jaundice, it's crucial to consult your doctor. These subtle symptoms can be an early indication that something more serious is happening inside your body. What to do if you notice these signs? Now that we've covered the 11 warning signs of pancreatic cancer, you may be wondering what to do if you're experiencing any of them. The most important thing is not to panic, as these symptoms don't necessarily mean you have pancreatic cancer. Many of them can be caused by less serious conditions. However, it's always better to err on the side of caution. The first step is to consult with your doctor, who can run the necessary tests to determine if further investigation is needed. Early detection is critical when it comes to pancreatic cancer. If caught in the early stages, there are more treatment options available, and the chances of a positive outcome improve significantly. Don't ignore what your body's telling you. Trust your instincts. If something doesn't feel right, it's important to get it checked out. Remember, you know your body better than anyone else. Even subtle changes can be a clue that something is off. So if you've noticed any of the symptoms we've discussed today, don't hesitate to seek medical advice. Early action could make all the difference. Take care of your health and don't wait to address any concerns. That's all for today's video, everyone. I hope you found this information valuable and that it helps you stay informed about your health. If you learned something new today, don't forget to give this video a thumbs up and share it with someone who might need to hear these important signs. Your health is in your hands and awareness is the first step. Also, make sure to hit that subscribe button and turn on notifications so you don't miss any of our future health tips and life-saving information. To help you even further, I've selected 2 videos at the end screen that will guide you on improving your overall health. Click on those to continue learning how to take better care of yourself. Thanks for watching, and as always, stay healthy and take care of yourself.